Hello, I'm your host, Sofia, and welcome to the Medcast Plus show. On the show, I'll feature local community physicians who are experts in their respective field and who will share their experiences and wisdom so we, as a community, can become an area of powerful influence and a betterment. I invite you to get involved as a community so we can all become more educated and more tightly connected and to make a difference. Today, my guest is Dr. Sofia Novak. She's the director of Women's Gastroenterology Center at Brooklyn GI and Endoscopy Group. Welcome to the show.
Thank you, Ася and Medcast, for having me today.
So today we'll be talking about a plethora of topics, one of being colorectal cancer. Can you tell us a little bit about that?
Of course. Colon and rectum is your large intestine, and it is the most preventable cancer in the United States. Colorectal cancers are the third most common cancer in the U.S. and the number 2 cause of colorectal deaths in the United States. The incidence of colorectal cancer has started to decrease due to our screening methods. Screening methods are successful because 90% of colorectal cancer comes from pre-malignant lesions and thus can be prevented.
I'm glad it's preventable. But can you tell me what a screening test is, doctor?
In general, a screening is a test that helps identify people at risk for developing a certain disease before they know they're at risk, before they develop any signs or symptoms of the disorder. For example, when you go to your physician, they might do blood work or stool studies, or in the case of gastroenterologist, a colonoscopy perhaps. For example, a blood work can be done to check for cholesterol, blood pressure can be measured to check for high blood pressure, and we also check blood work for diabetes. A skin exam is done to check for skin cancers. All of these are preventable causes and can be decreased in incidence. Screening saves life if only you go and get tested.
I hope our viewers do get tested when they get the chance. Doctor, can you tell me about colon polyps?
Sure. Colon polyps is what most of the colorectal cancer comes from. They're little growths. They vary in size from a few millimeters to centimeters, so different sizes that go in your colon and rectum and your large intestines. They may turn into cancer, but not all of them do. In general, there are 2 types of them, a hyperplastic, which is a completely benign, and an adenoma. Those are the ones we worry about as gastroenterologists. They take a really long time to mature, grow, and change. The biggest risk for developing a polyp is if you're over 50, if you smoke, or if you eat high-fat, low-fiber diet. Thus, we recommend good diet for everyone.
Of course. And how does screening prevent cancer?
During screening, we aim to identify and remove polyps. By removing these growths, they no longer can transition into any malignancy. This doesn't prevent 100% of cases, but does decreases drastically. That is why we're seeing such decreases in colorectal cancer across the United States.
That's amazing. And what tests can screen for colorectal cancer?
There are magnitude of tests. For example, there are stool tests such as a FIT test, a stool occult, or a Cologuard. They're done at various intervals depending on how accurately they catch polyps and cancer. There are virtual colonoscopy and barium enema. These are radiological studies. You can also do flexible sigmoidoscopy, which goes about 1/3 of your colon through, or colonoscopy itself. Now, colonoscopies only needs to be done every 10 years if it's successfully done and there are no polyps found. We might do it a little bit more frequently based on what we see.
Dr. Novak, in your medical experience, why do some people fail to get screened?
Most commonly I hear there's nothing wrong with me. But as you heard me say before, these tests are done on patients who don't have any symptoms. It will hurt. The colonoscopy is done under anesthesia, so you don't feel any sedation, and all the other tests have minimal discomfort. It will be embarrassing. Oh, I'm afraid of anesthesia. In fact, only 1 in 3 adults, in fact, only 2 out of 3 adults in the United States get screened which is about 60-75%, depending on the state you look at. Massachusetts is the number one in that category, with 80% of the population getting screened. Ultimately, any test is good that you get done.
That was very informative, thank you. Doctor, what would you say the most common symptom is?
So the most common symptom is none. Polyps do not produce any symptoms. Colorectal cancer in the early stages rarely produces symptoms. Some of them might bleed, but the bleeding is very minuscule and is usually not seen. As the disease progresses, obstruction can occur, gas and bloating, and patients might lose weight and have drop in some of their blood counts called anemia.
That's crucial information for our viewers to know. Doctor, what can people expect on the day of the colonoscopy?
The day of the procedure is very easy. The hard part is done. You've already finished your prep, and now you're just coming in to do the procedure. You'll meet the team, the gastroenterologists, if you haven't done so prior to the visit, the anesthesiologist, the nurses will be taking care of you. A small IV is placed into your arm, and that's the biggest pain you're going to have. The rest of the test, you're completely comfortable with anesthesia that is provided. And when you wake up, you generally wake up in the recovery room. By the time you wake up fully, a little bit of monitoring is done, and then the doctor will go over the results with you and determine a proper surveillance interval or screening interval that you will need to adhere with.
Thank you, Dr. Novak. That was extremely informative. Hopefully it will help stigmatize colorectal cancer and urge people to get screened. Stay with us. We'll be right back after a short break. Welcome back. I'm here with Dr. Novak, and on this segment we'll be discussing hepatitis C. Dr. Novak, can you tell us about hepatitis C?
Of course. Hepatitis C is a virus that affects your liver. Majority of the patients go to develop a chronic liver disease. Now, the challenging part is most people are asymptomatic, meaning they don't have any symptoms of the disorder until the very end stage. It affects about 3.5 million patients in the United States, but only half of those are aware of having the disorder and thus don't know to seek treatment until it is late in the course of the disorder. It is a curable disease, meaning we can completely eliminate it. And it's still, despite being curable, it is still the most deadly virus, more deadly. It causes more deaths than HIV. It can affect other organs other than the liver, but we'll talk more about that later.
Oh, how interesting. I didn't know that. So what are some symptoms of hepatitis C?
So during the acute infection, most patients don't feel anything. They're completely asymptomatic. Now, a small percentage might feel fever, they might vomit, they might feel a little nauseous and fatigued. You might notice a little bit of darkening of your urine or yellowishness of the eyes, of the skin, but that is very rare.
Dr. Novak, who should be screened?
So multiple liver societies recommend screening of anybody who was born between 1945 and 1965. We also recommend screening of at-risk individuals. How do you know you're at risk? If you've been exposed to any blood products. For example, if you had a blood transfusion prior to 1992, if you've had IV drug use or used recreational drugs using a straw perhaps, if you've been exposed to an accidental needle stick, if your mom had hepatitis C, or if you've been exposed to improperly sanitized equipment. Now that equipment can be found in a tattoo salon, in a body piercing salon, as well as in a nail salon and a barber shop.
Good to know. And what are the treatment options?
Now, this is a very exciting time in the United States. We have numerous options for treatments. There's Declinza, Zepatier, Harvoni, Tecnivir, there's Vicira, Sovaldi, Epcluso, Alisio, and Ribavirin. There are numerous medications. These are we use combination of drugs or one of those brands by themselves, and usually it's an 8 to 12 week course of medications with minimal side effects. They have great response rate and great cure rates.
That's very optimistic. So how are treatments determined?
On an individual basis, like most things in medicine, we look at your specific hepatitis C virus genotype. They're numbered. It's kind of the flavor of the hepatitis C that you have. We look at the insurance and what medications they would cover. We look at what medications you're currently on and what side effects a specific medication might have that would be improper for the specific person. We look at how damaged is the liver and what other organs are affected, as well as we look at what other viruses a patient might have, like hepatitis B or HIV. And of course, we look at other medical conditions such as kidney disease.
In your medical experience, what are some misconceptions about hepatitis C?
The biggest misconception I find is patients saying, "I feel fine," because they don't have any symptoms during the first couple of decades of the virus. The other misconception we hear sometimes is, "Can I get a vaccine against it?" There is no vaccine for the virus. The third most common misconception is that hepatitis is a sexually transmitted disease, when in fact it's not. It's a blood-to-blood transmission only. So if your loved one has hepatitis C, you can give them hugs and kisses, just don't share a toothbrush with them. Another misconception I hear is that hepatitis C will go away on its own. It only happens about 20% of the time. So another misconception we'll hear is that it will go away on its own. The hepatitis C is cured by itself in only 20% of the patients. 80% will progress to having a chronic hepatitis C that would require treatment with above mentioned medications.
That's very informative, thank you. And what happens if you don't get treatment?
So hepatitis C over decades can progress to cirrhosis. It only progresses to cirrhosis in less than 20% of patients, meaning if 5 people have hepatitis C, chronic hepatitis C, only one of them will progress to cirrhosis. People who are more likely to progress to cirrhosis are those who smoke, who are overweight. The hepatitis C virus can affect other organs as well. It can increase your risk of diabetes. It can increase your risk of thyroid problems, depression. A lot of people who have hepatitis C suffer from what we call brain fog or forgetfulness and confusion. Cirrhosis itself is just scarring of the liver, and as it progresses, as more and more liver scars, eventually can go into liver failure or cause a tumor to form, hepatocellular carcinoma in that scar tissue.
Doctor, you mentioned liver cirrhosis. Can you tell us a bit more about that and how can it be avoided?
So the best way, liver cirrhosis is scarring of the tissue, and it affects about 1 in 5 individuals suffering from hepatitis C, chronic hepatitis C, or less. Now, it takes about 20 to 30 years for hepatitis C to progress to cirrhosis. And in general, you want to avoid risk factors for cirrhosis, such as alcohol use. Obesity is a risk factor, so you want to eat healthy food and proper exercise and nutrition. You want to avoid having another hepatitis affect your liver, so you want to avoid foodborne illnesses with hepatitis A. You also want to avoid some other foodborne illnesses. So we generally, patients who have liver disease, we don't recommend eating oysters or sushi or other raw fish. Also, we don't recommend eating unpasteurized milk. Now, the good news is there are some studies that suggest coffee might be of benefit to prevent liver cirrhosis. So there's a big plug for coffee use in moderation, of course.
Thanks. So given the severity of hepatitis C, what does recovery look like?
If we treat hepatitis C prior to developing cirrhosis, the success rate of therapies are over 90%, closer to 99%. And then you're cured. You do not, we check the blood work 3 months after therapy, and if it's negative, you need very minimal follow-up with your physician, if any.
Thank you, Dr. Novak. That was very informative, and hopefully our viewers will appreciate the information and heed to it. After a short break, we'll be right back. Welcome back. I'm here with Dr. Sofia Novak, and today she'll tell us about constipation. Now, I'm sure our viewers have a preconception about what constipation is, but let's get a medical opinion on what that really is.
Constipation really varies from person to person. Some people conceive constipation as hard stool that's difficult to get out. Others feel that it's infrequency of your bowel movements. Some people report that a sense of not feeling like they've emptied after a bowel movement. All of those can be considered constipation. Some associated symptoms with constipation are typically discomfort in lower abdominal, potentially nausea and bloating. It's a very common complaint that we see in our practice. About a third of the patients suffer from constipation in either short-term or long-term.
What are the most common causes of constipation?
So the most common cause of constipation is American lifestyle, meaning we don't drink enough water, we don't eat enough fruits and vegetables or fiber, and we don't exercise enough. The other serious, more serious cause of constipation is a medication side effect. There are GI disorders that cause constipation, such as irritable bowel syndrome, functional constipation, or motility disorders. Motility disorders to refer to when your gut doesn't move fast enough. There's some hormonal or endocrine disorders, for example, diabetes and hypothyroidism, that can lead to constipation. Also neurological disorders, for example, Parkinson's, stroke, back injury, that can lead to constipation. Of course, there are more worrisome causes, such as tumors, but thankfully those are very rare.
Given the casual occurrence of constipation, when should one actually go see the doctor for it?
We refer to these as red flags. Red flags is what should bring you to the doctor. For example, if you see blood in your stool, if you used to go once a day and now you're going once a week, when there's a change in how frequently you go or in the caliber of the stool, meaning all of a sudden looks like a pencil, then you should see a doctor. If there's pain associated with bowel movements, if you notice your belly's getting distended, getting bigger, if there's any nausea, vomiting, if you start losing weight and you're not trying along with constipation, if you're fatigued and tired, or anytime constipation interferes with what you're doing in a day-to-day life. Also important to note, if you're constipated and you haven't had a bowel movement for more than 3 weeks, you should see a doctor.
That's crucial information for our viewers to know. But what happens when constipation goes completely untreated?
So first of all, don't avoid it. Take care of it. Because if treated, there's no long-term complications from constipation. In general, when we do see severe side effects from patients having constipations are those who can't communicate with us, such as patients who are elderly and demented or mentally challenged. Those patients can't communicate when constipation leads to pain, distension, and discomfort. And thus it can truly lead to impaction where the stool obstructs the colon, and when the pipe is obstructed, it dilates, and can actually have microperforations or full perforation of the bowel, and thus serious complications can occur.
I see. And what can patients do at home to prevent constipation?
So most importantly is changing your diet. For example, eating more healthy vegetables, eating more fiber with your berries and beans, drinking more water is very important. Also, you can use natural laxatives. These are foods that will aid you in going. The most common foods that we use is prunes, apricots, especially dried apricots, figs, cantaloupes, and kiwis. They will all aid. And don't hold it in, meaning if you feel the urge to go, you should go, or at least attempt to go. Patients often will hold it in, and then it progresses to more severe forms of constipation. Small, frequent meals will help as well.
Got it. So is it okay to take laxatives?
Well, as everything in life, it depends on how much and what type of laxative. It also depends what else is going on in your body, what other medical conditions you have. So patients with heart disease, kidney disease, or those who are pregnant should definitely see a physician first. In general, enemas work faster, but we don't like to use them as frequently long term.
So given that people are very quick to use laxatives to aid in relief of their constipation, what are the side effects of laxatives?
The most common side effect of a laxative is diarrhea. When you take too much of the laxative, you get the desired effect, diarrhea. Laxatives also work in different ways, and as a result can cause gas, bloating, and cramps. The bulk-forming laxatives such as fiber can even cause constipation if not taken properly. If you take fiber without combining it with an adequate amount of water, you can develop constipation even worse. There's some laxatives that draw moisture in, and thus you can get thirsty from using too much of it. There's some laxatives that will change your electrolyte balance. Now, electrolytes are those important chemicals inside you that regulate the reactions that happen. When they get disbalanced, you can cause damage to other organs. So seizures can occur, kidney damage can occur, as well as heart disease through arrhythmias. Now, those laxatives are usually written by prescription, but can be done with any of the laxative. The other thing that can happen is the dependency on a laxative.
Oh, I didn't know that. How interesting. Doctor, can you tell me about the medical treatments for constipation?
Medical treatment is always tailored to you individually. We go over the medical history in depth to see what are your habits, what are your daily activities like, what medications you take, what other medical conditions you have, and then we might suggest some dietary modifications. Some blood work can be done to evaluate for certain other conditions that cause laxatives, and possibly imaging will be recommended, but it's very individualized.
Thank you, Dr. Novak. That was a very informative segment. Thank you for your interest in the show and your desire to become involved and educated. I invite you to visit our website at www.medcastplus.com and check out our tools and connect with us on social media. You can also call us at 718-510-2103. Please stay well and be safe. Goodbye.